So the first area that I'd look out for with a histamine issue is the digestive system, because histamine is often increased in our body when we've been eating histamine-rich foods or foods that liberate histamine as well. So look to the gut, and I'd be looking for symptoms like heartburn, indigestion, reflux, diarrhea, IBS-like symptoms. You can get bloating with it, you can get fullness, even vomiting can be a sign of histamine. So symptoms that are central to gut health, but also to other mucous membranes as well. So the typical symptoms of hay fever, sniffling, sneezing, itchy eyes, itchy palate. Out in the skin rashes, you could have pimples and acne, eczema, urticaria, so things like nettle rash. And then you can have other problems like palpitations, you can get shortness of breath, feeling dizzy, low blood pressure. It's multi-system. It seems to affect lots of different areas in the body. People feel chilly and shivery sometimes when they have histamine as well. So very, very widespread symptoms. And that's what you're looking for, is it not just being one area of the body. So it's not just gut. It's going to be gut and other mucous membranes. So it's multi-system effects is a good indicator that you've got histamine in the background there causing issues.
It's really not something that you can pinpoint accurately without taking a good look at the person who's presenting themselves in front of you. Just going back to histamine foods, histamine-rich foods, let's just go over what those could be, because we talk about gut health. Now, for most people, gut health means taking probiotics. It means eating yogurt, eating ferments like kimchi, drinking kombucha. But eating these things and drinking the fermented teas and the other drinks is not necessarily what we should be doing if we have a histamine problem.
No, there are things that can actually increase histamine. So, people do find that they can exacerbate symptoms. Things that tend to push histamine up are old foods. So foods that have been hanging around for quite a long time. I know of people that will eat a fresh bit of roast beef and they're fine, but if it's been sitting around on the carvery for a couple of hours, wham bam, they're into histamine. Cheeses, aged foods, pickles, cold meats that have got preservatives in them can all stimulate histamine, but also some fresh fruit and vegetables as well can do it. So it's think about your red fruits. So your tomatoes, your peppers, your chilies can all be quite high in histamine. Unfortunately, it is pulses. Soy is quite a high histamine food. Chocolate's both high in histamine and a histamine liberator. Nuts and seeds, avocado. There's actually quite a lot of foods that people will eat that are high in histamine when they're on a plant-based diet. So actually being a vegan, if you have a histamine problem, is really difficult. And I've had a few clients that have really struggled with histamine issues that are vegan and trying to get a diet that's actually low in histamine, because all of these things that they are leaning to for protein tend to be quite high in histamine. Lower histamine foods tend to be things like root vegetables, freshly cooked meats, fish, etc. And green veg are particularly, good for keeping histamine low, apart from spinach, which
I was just going to say, I understand spinach isn't a good one, yeah.
No,
which is my
there's
favorite.
Always exceptions, yeah. Always exceptions to rules going on there. So yeah, the other thing would be with fruits, it's going to be your oranges and your citrus fruits, pineapples. These sort of things are quite high in histamine as well. So it's about looking at reducing them, but not cutting them all out. It's about just trying to eat less of them all on one day together, basically.
And avocados as well, I think I read somewhere, are quite high in histamine.
Yeah, avocados. Yeah, some people find they're a real problem. Some people say bananas, other people say not. Yeah. There is no exact science with histamine, that's the issue. So you really need to do the detective work, maybe keep some diet diaries and see what's going on. And I would say for anyone, if they're listening in and they're thinking, oh, I wonder if I do have a histamine problem, you could go, there's maybe Google Histamine Intolerance UK. They've got information about the different symptoms, the diet, and just maybe going on a low histamine diet for a couple of weeks might be enough to actually give you the answer. Because if you cut histamine right out and you feel a dramatic improvement in how you're feeling, then histamine probably is the mediator that's at the back of a lot of your symptoms.
Yes, and just notice when you are building up again what you're eating. So if you go back to, again, I'm back on the ferments. If you go back to drinking your kombucha regularly and you notice that you're getting the symptoms again, you'll know very quickly that that's what the problem is. Yeah.
Yeah, yeah.
And we're seeing a lot more of this right now, aren't we? We're seeing a lot
Histamine.
more people. Yeah, a lot more people presenting with problems with histamine.
Yeah, it's massive. You know, I look at what's going on in my clinic and the herbs that I'm prescribing and how I work now compared with when I started in practice. I mean, I've been practicing now for 25 years, which, you know, a quarter of a century of herbal practice. Back then, everyone had candida and yeast infections, and we tend not to be seeing so much of that anymore. It's histamine, histamine, histamine just seems to constantly be walking through the door. And I'm seeing people with hypermobility syndrome, with mast cell activation disorders. There seems to be a lot of histamine issues going on. And I think that's because histamine is, you know, key to our immune health. Now, part of doing this program, I've been doing loads of research, JJ, because I thought I'm going to prepare myself for the show and read around histamine. I couldn't sleep last night because there was so much going around in my head about it, because it's so much more than I even realized. You know,
Wow.
you know, we talked about, you know, we spoke last show about, you know, what's the function of histamine, and it's there to, you know, it's there to protect us. And when we were running around in that swamp and we met something nasty, we'd flush it out. Now, I pulled up some research papers last night and I was completely blown away because histamine is everywhere. We've got 4 different histamine receptors in our body, and they are involved in so many aspects of immune responses. And the interesting thing is, it's not just pro-inflammatory, it can actually have an anti-inflammatory response as well. It can signal other compounds. It's a signaling chemical. It directs the traffic of other chemical mediators. And I think that's really interesting, because I think that explains why it has such wide effects in the body.
Absolutely, yeah, yeah. And you can understand then why it's taken the medical profession so long to cotton on to what's going on here, because you can't really pinpoint one thing.
It's not just one thing. No.
And who would have thought that it would be histamine?
Yeah. So, you know, because it's a signaling molecule, I mean, I could go into the science of it and pull up, I mean, I've got a paper in front of me now and it talks about the different cells, the different chemicals, the intracellular signaling. And it is, you know, it would just probably not make any sense to anyone if we start talking about all these big medical jargons. But, you know, to look at it and break it down really simply, I would sort of say that what histamine is like traffic lights. It keeps traffic flowing within the immune system. And while the traffic lights are working properly, great, everything just flows and it's as it should be. But if those traffic lights break, then you're going to start having problems. People start blasting the horns, the bumpers get bumped, road rage ensues, diesel gets spilt on the road, and you've got a great big mess on your hands. And I think that's what happens with histamine when the signals go off kilter. It's the traffic light system, I think, in our immune systems. And that's really come to light for me looking at all this research. And it, you know, it's like drawing things together. I've realized it's so massively involved in our immune systems. It's more than allergy. It's tied into autoimmune conditions and inflammation, and even cancer cells have got histamine receptors on them. I mean, that was a real eye-opener for me. Yeah, even cancer cells have got histamine receptors. And I know that a lot of the natural remedies that are indicated for cancer have got a natural antihistamine effect. We spoke about quercetin last time, about how it's good for histamine. There are lots of research papers looking at quercetin in cancer and reducing inflammation. And we know, you know, cancer causes inflammation. It's an inflammatory condition. It leaches out into the connective tissue and creates inflammation and damage, and that's how it spreads. And histamine is part of that inflammation that we see with cancer. Orthodox medicine is now looking at histamine or antihistamine protocols, targeted antihistamine protocols as part of cancer therapy. And this is all just coming to light. We're understanding more and more and more about how histamine behaves and its damaging effects within the body.
It is extraordinary, isn't it? And so many things can be traced back to an issue with histamine as part of the cause, if not the cause. I was reading something the other day which pointed to, you mentioned endometriosis, dysmenorrhea, a whole load of problems for women linked to histamine, but also, and miscarriage as well. It was another issue.
It's massive, really massive. And I think to me, it's a bit of a missing link as I'm looking at this in more detail. There's so many things that it explains in the immune system. And it's certainly an area I think we really need to focus on. And I've got one woman I worked with, and I think I did mention this last time, a rheumatoid arthritis, where I put her on a low histamine program and her rheumatoid arthritis got better. So it does seem to be really closely connected to these autoimmune inflammations, and they're all on the increase as well. We look out in society, and what are the sort of things we're seeing? Well, irritable bowel problems. We've got a massive increase in autoimmune conditions. We're seeing neurodegenerative problems like Parkinson's on the rise. That's a particular one of interest to me because I've got a big family history of Parkinson's, and that's partly where my obsession with mushrooms comes from, because I know that the mushrooms, and there's a few of them, are indicated in reducing inflammation that can be behind Parkinson's disease. And we now know that Parkinson's is related to potential gut bacterial problems, and through the vagus nerve, it's causing this sort of inflammatory reaction up into the brain. So, histamine can even be quite damaging in the nervous system. So we just look out into society and we're seeing allergies, autoimmunity, inflammation. It is at epidemic, I would say pandemic proportions is the histamine situation. Yeah.
Yeah, and talking of pandemics, we have COVID now, of course, and you've made links there as well.
Yeah. Well, scientists know that there's inflammation with COVID. When COVID came on the scene a year ago, we were all thinking about it as being a respiratory infection, which it is. It does cause respiratory symptoms. It's we believe it's spread by airborne infection. That's why we're all wearing masks. But we breathe in this COVID virus and it gets into our airways. So it starts off as a respiratory infection. But it doesn't just stay within the airways. It causes multi-system inflammation. And scientists do understand that there's different chemical mediators going on there. There's some chemical compounds, interleukin-3, interleukin-6 are two inflammatory compounds that science is focusing on. And these are called inflammatory cytokines. And actually, inflammation is what we want. When our bodies are faced with something, we want inflammation, because inflammation gets blood going to the area, it gets all the cells going to the area to try and heal what's going on. But with COVID, that inflammation just ramps up out of control. It just starts to go ballistic. And it's these cytokine storms that are actually causing the real damage. So the people that are dying from COVID have just got this systemic inflammation going on. And it's not just affecting their lungs, it's getting into the blood vessels, it's getting into the nervous system. There's meningitis and brain issues going on with it. So it's a multi-system inflammatory condition. And we understand that histamine is a signaling molecule in inflammation, and histamine can push out things like interleukin-6 levels. It should actually reduce some of the other compounds which should help to reduce that inflammation. And the scientists just don't understand yet why the inflammation isn't being dampened back down. And I do wonder whether histamine will come up on the radar of research. I'm not sure that anyone's looking at histamine yet in research, but I think it probably will come up. I think we need to look at it, because I think it is part of the reason that we see such inflammation there. And it also makes me wonder, JJ, whether we have so many issues with COVID now, because we have so much histamine problems in our society.
Yeah.
Has COVID come about because we've got the right soil for it to grow as such, and why does one person walk around with COVID and not even know they've got it, and yet another person, can die from it? It's so extreme, the sort of two areas. And then we've got the situation where some people are really low histamine and some people are really high histamine. It's that part of the connection here. That's what I'm asking myself. And I think it's something that, we need to look at further.
Yes, exactly. And it would be extraordinary to find out that was one of the major factors with COVID, wouldn't it?
Yeah.
Because, a lot of people are saying that people who die are dying with COVID, not of COVID, and so very few people are dying from COVID itself. But it's bad enough to think that anybody's dying at all. But to factor then in histamine is another level altogether.
Yeah, is that one of the signalers? Is histamine signaling part of the problem? And what we do understand about COVID is that it is associated with other inflammatory conditions. So if you're obese, you're more likely to suffer from more severe symptoms with COVID. And we know that obesity and inflammation go hand in hand. If you have diabetes, your outcome with COVID is going to be potentially worse because diabetes is associated with inflammation. There are connections. I don't know about histamine and people from the BAME community, where there's a connection there. In terms of vitamin D, I think there's a lot of research looking at vitamin D at the moment. And I don't know if we're definite about vitamin D and histamine, but vitamin D does reduce inflammation down. And of course, I would see histamine as particularly being the fan that fans inflammation up. So I think it drives it. So maybe vitamin D is working because it's reducing histamine, reducing inflammation, and the histamine signaling isn't having such an effect.
So maybe the vitamin D is helping to reduce inflammation, but then you would have to, one presumes, also work on not having so much histamine in the system in order to get over whatever.
Yeah. Well, certainly, I'm sort of thinking what I want to do in my preventative health strategy is to keep an eye on my histamine levels. I've said to you before, I feel like I'm really low histamine, but we actually all have histamine because it's an essential chemical that is involved in so many processes. I work with my histamine levels by taking probiotics and reishi mushroom. We touched on that previously. I think that's quite a good normalizer for histamine in the body. But the probiotics are really interesting, that whole gut bacteria thing, because we know that being dysbiotic and having imbalance with our microbiome really increases our tendency to allergies. So the more sterile our gut, the more allergic we're going to be. And actually, the probiotics are really important for blood clotting as well. They're involved in vitamin K metabolism, and you are more likely to have clotting issues if you have gut bacterial problems as well. So, and here we have COVID, clotting. Is there a connection there between gut flora and histamine and COVID? I think there's lots of loops within loops within loops here. And I think, well, there is not one answer. If there was one answer to COVID, science would have found it by now. I think it's just so multifactorial that, it's a bigger picture. And we are, I think you always have to look at the bigger picture. We are whole energetic beings with a whole sort of chemical soup going on in our bodies as such. And I think it's really, really complex. We're complex, and the way we need to think about it is maybe complex.
And so tell me a little bit more about the probiotics, because as we said before, the gut flora is very important, but for most people, creating a healthy gut flora means eating yogurt, drinking things like kombucha, but those can actually increase the histamine in your system. So what do you do about that sort of thing? In order to balance out your gut flora, what would you need to do?
You need to eat a good clean diet, not a sterile diet, that's for sure. You need to make sure that you have enough of the prebiotic fibers in your diet. And there's a lot of interesting research now looking at probiotics and prebiotics. And it's actually the prebiotics that you eat in your diet that probably have the biggest influence on what's going on with your gut microbiome. So it's eating things that, things like root vegetables, fibers, wild foods, I would say, would give you some prebiotics and probiotics. Mushrooms particularly are good to give you the prebiotics and probiotics. Things like Jerusalem artichoke, foods that make you fart, JJ, will probably help your gut bacteria.
Good. Thank you.
Grow, but that's so the gassy producing foods tend to be the prebiotic foods. So things like Jerusalem artichoke is a fantastic prebiotic. Inulin is a really good prebiotic as well. So it's making sure you actually get enough of the prebiotic fibers, because that's the food source for the probiotic bacteria. That's what your bacteria need to thrive. So you could take a really expensive probiotic supplement, but if you're eating a bad diet, you're not going to benefit from them because they've not got anything to nourish them and to multiply. It's actually putting all the right food in the first place. And if you think about our ancestors, they're running around eating a really big variety of foods. So the more variety you've got the wider your gut flora is going to be. And variety is the spice of life when it comes to your microbiome. You want lots of different bacteria in there because they all do lots of different things. But yeah, our ancestors were probably out eating about 350 different roots, fruits, nuts, seeds. You look at the average Western diet, you know,
half a dozen,
maybe, you know, or, you know, people eat a lot of wheat, they're eating a lot of dairy, lots of processed foods, things like artificial sweeteners kill your gut flora, having a dose of stress kills your gut flora. So there's all these things that are quite toxic to gut bacteria as well. And people are just not eating the variety, you know. I'll sometimes talk to people of the diets, what are you eating? Well, I eat peas and broccoli. Well, you know, yeah, peas and broccoli are great, but they're not enough. We need to be eating a really, really wide variety, probably of seasonal fruit and veg, organic if possible. I think that's really important. And, you know, organic, dare I say, unwashed fruit and veg might be even better. A bit of dirt would do us good. There's lots of soil microbacteria that are really important for us. It's that sterility again, that sterile gut is not good.
No, we used to eat a lot more dirt, actually. I mean, you know, people laugh at me when I say that, but we did used to eat a lot more soil.
We used to eat soil. We used to eat animal feces because we lived next, you know, we'd be out living next to animals and we'd be getting all sorts of stuff in our diet.
Yeah, it is true.
Yeah, and it would prime the immune system. It would really support our immune health. There's interesting studies looking at, you know, allergies, kids with allergies and their microbiome. And there was a documentary on the telly 5 years, 10 years ago, possibly. And what they found was the kids with the worst allergies were the most sterile kids.
Yeah.
You know, so, you know, we've got a massive epidemic of kids with atopic conditions and allergies. What they need to do is go to the woods and eat their lunch without washing their hands, you know, which, you know, when I was younger, we had horses. I used to go muck out the stables and then have my lunch. I didn't wash my hands, you know. And,
you shouldn't be admitting that, really. Shouldn't be admitting that on radio. No.
You know, I've got good gut health, that's it. But, you know, I'd be more inclined to wash my hands. I'd be more concerned about washing my hands if I've been in a supermarket than I would if I'd been in the woods, you know. So, you know, because supermarkets probably are a bit germ-laden. But
well, not so much now, of course, because everything's being cleaned rigorously these days.
Yeah,
you know,
that's true. And actually, JJ, I don't know that that's going to do us any good because it's back to that sterility again. You know, we've got bacteria that live on our skin that are, you know, they're commensal. They're part of our immune system, and we're smothering them with all this sanitizer. And I'm not sure that that's going to serve us well in the long term. So I think some of the measures we're taking to try and combat COVID are actually not going to be very good for our immune systems in the longer term. Even mask wearing, you know, what's going to happen when people stop wearing masks? We're going to have an epidemic of colds and sniffles. And suddenly all the other respiratory viruses are going to be out there and people are going to feel like lepers, won't leave the house if they've got a sneeze in case, you know, they're deemed to be carrying COVID. So there's some of the measures we're doing now, I think, might come back and bite us a little bit further down the line.
Yeah, you might well be right. I want to get back to the vagus nerve and what part that plays in histamine and inflammation in the body, because the vagus nerve is hugely important, isn't it?
It's hugely important. And again, it's something that we are understanding more and more about all the time. Now, when I was studying anatomy and physiology in my training, we learned about the vagus nerve as being a cranial nerve. And we have 12 cranial nerves in our head, and they're involved in different mechanisms like making your eyes move and your pupils dilate and involved in different reflexes. The vagus nerve is interesting. It doesn't just stay in the head. It's traveling down the body. It innervates the lungs, the heart, the stomach, even down to the kidneys as well. So we have this nerve that directly connects the brain to our internal organs. Now, all the other nerves that we have going around our body in, you know, beyond, outside of our head as such, come from out the spine. So it come down the spinal cord and innervate everything. Whereas the vagus nerve directly connects our brain to our stomach. It is a superhighway. You could see the vagus nerve as being the thing that connects the internal processes from our digestive system, our lungs, our airways to our brain. So it signals to the brain what's going on. And the function of the vagus nerve is both sympathetic and parasympathetic. It's both stimulatory and relaxing. And if you have a virus, so I breathe in a respiratory virus, it could be COVID, it could be another virus. our vagus nerve will register that, and it will send out an immune response. It will send out signals to make T cells and inflammation, because by getting T cells to the site and getting inflammation going, it actually helps to get rid of the infection. You know, we inflammation, histamine in there, flushes things out. And what should happen is, after the virus has been eliminated, the vagus nerve will go into parasympathetic mode, and it encourages rest and recovery. So it is involved in those immune processes. So it's actually a very big part of our immune system. And this is something that, again, is really coming to light now. It's not something that I learned about when I was studying. When I learned about the vagus nerve, I learned about it being involved in heart rate and digestion. I didn't learn anything about its immune aspect at all.
Wow.
But it's a key immune signal, which is really, really important for the immune pathways. And I think what's really interesting with the vagus nerve is it does connect the stomach and the blood vessels and the brain and all these other organs. And I think, is that where the connection comes with COVID? Is that why COVID doesn't just stay in the lungs and it goes somewhere else? Through this vagus nerve connection. Now, I don't know if COVID gets in there and actually gets into the nerve itself, or whether it's through an inflammatory reflex. So, you know, if you've got loads of inflammation in the lungs and it's becoming more and more and more severe, does that then create a reflex response where the vagus nerve then sends out signals to other organs in the body to start ramping up inflammation? And that's where we see this multi-systemic effect coming in. So, I think it's really, really interesting to look at it. Vagus nerve is key to our mood as well. It can have a big impact on how we're feeling. It's the rest and digest nerve. It's the parasympathetic division is really important for us to restore ourselves and recover. So I think it's fascinating. I think it's something we'll find out much more about over the next few years. I think there'll be a lot of focus from orthodox medicine on it, and certainly, you know, naturopathic practitioners are really geared up and clued up to what's going on there.
So are there things that we can take to bolster our systems, to reduce histamine if we have high histamine in our bodies? You've mentioned reishi, mushroom. You've mentioned a few other things in the last show that we did together. You mentioned a few things. But what else can we do to lower any histamine in our bodies that might be causing an issue?
I think you need to address any nutritional imbalances. I think you really need to address your stress levels. And this comes down to adrenal pathways and also down to that vagal pathway as well. We know that steroids reduces inflammation. And actually with COVID, they're using steroids to dampen down the inflammatory conditions that are going on there. So if your adrenals are really exhausted with stress, they're not going to be very good at calming down inflammation. So you really need to get on top of your stress levels. And that is, you know, trying to eat properly, trying to balance activity and rest, go into the rest mode. That's all about the vagus nerve. So you actually need to, I think, address both together. So I think correcting your diet, making sure you've got good levels of gut bacteria and all your micro and macronutrients being in balance is important. But I think doing things like yoga, meditation, I think singing, laughing is probably really, really important. Laughing helps to stimulate the vagus nerve and helps it to reset. So having a good old belly laugh that makes you clutch onto your sides is probably a really important thing for calming down your immune system, calming down inflammation, possibly calming down histamine as well, if the vagus nerve is signaling and pushing histamine up. So I think trying to have a bit of fun and a bit of lightness, which is the very opposite of what's going on right now for everybody. You know, we're all these people living in fear and feeling stressed and anxious. All that is just having a negative effect on our immune systems, probably ramping up histamine for people as well. Yeah.
It's extraordinary to think that would be something that would influence our histamine levels, you know, just stress or laughter and just having a good time. It's amazing to think that would have such an incredible effect on our bodies.
Mm-hmm.
Now, the other thing that I wanted to talk about, and it comes back to this thing about digestion and gut. Some people talk about an enzyme DAO as being in short supply, shall we say, in some people's bodies, which is why the histamine ramps up, because DAO helps to deal with histamine, if I've got that right. You know, is that something that we should look at?
Yeah, DAO helps to break down histamine in the gut. I it doesn't break down histamine in the nervous system. But I would imagine that if you keep your gut histamine levels low, then that will, through the nerve pathway signals, calm down histamine elsewhere. So yeah, DAO is an enzyme that helps to break down histamine. It is influenced by vitamin D, I believe. It's also influenced by the levels of magnesium and B6 in our bodies and the health of our gut flora. So making sure that your nutritional balance is there can help with DAO balance, and helping, making sure you've got a good mixed diet, good healthy gut flora will make a difference too. But if you are lacking DAO, you can actually supplement it and buy it to take to help break down histamine. I mean, the other thing to do with histamine breakdown is the liver itself, because it's the chemical processing plant. So ensuring you've got really good liver function. And that could be as simple as, taking some digestive bitters, using things like dandelion, milk thistle, etc., can really help with liver health.
Yeah, so that's really interesting. And what I'm getting here as well is the importance of good nutrition, of really having a great, varied diet of all the things which everybody keeps telling us we should be eating, and how many of us don't. It's really important for us to have a routine whereby we can create good food daily that will support our immune systems.
Yeah, I think diet is the foundation stone. And you think about how our diets have changed so much in recent years. That post-war, probably people had the healthiest diets in this country. They were eating seasonal foods. They were really limited with what they could get their hands on, but they were really healthy at that point. And, I remember when we were younger, every meal was home cooked. It was always freshly prepared food that we had. Although I have to say we did have puddings most nights as well, but they didn't seem to do us any harm at the time. But they were all homemade as well.
I was going to say they were homemade and nothing
they
much.
Were homemade. Nothing artificial in there.
Yeah.
So our diets are really important, and it is a really interesting thing that so many people say to me, "Oh, I don't have time." And it's actually it's one of the most important things you can do is to really make sure you're eating well. I mean, I work full time and I've got a family. What I do once a week is I actually menu plan. I write it on a whiteboard, and then I go and shop, and I make sure that I've got everything in the house for that menu, and that's it, job done. I don't then think every day about what we're going to eat. I don't think, oh, there's nothing in the house for dinner tonight. Actually planning ahead can actually save an awful lot of time and effort. And we will often, have a reheat the next day. For somebody with a high histamine issue, that might be a problem, but it doesn't cause me any harm to have a reheated meal. But yeah, planning around meals, put a little bit of effort in, can save a lot of time. And if you do have histamine problems, you really do need to plan. You really need to think ahead with what you're doing.
Yeah, I think that's absolutely true. And freezing's okay though, isn't it? Cooking ahead and freezing, and then
cooking ahead and freezing. Yeah, it's when it's sitting around for a long time in the fridge for days. When you're doing the sniff test and thinking, can I eat that? It's not something that people should be doing if they've got histamine problems.
Or cutting the mold off the cheese and then eating it. That's probably not the best thing to do either.
I don't know. I think we deliberately eat moldy cheeses, don't we? Some people, but but again, not if you've got histamine problems. Exactly. That's going to be an issue. Yeah, but the difficulty comes, I guess, when somebody has histamine problems and they're feeling knackered. Then trying to sort their diet out can be really, really difficult. And we've talked about histamine tied into COVID. What I'm beginning to see coming through in clinic now is people with long COVID. And we're seeing that all over the news at the moment. It was on the news last night, long COVID. There's, I think, centres in England where they're starting to look at how to manage long COVID conditions. What I'm seeing that my long COVID clients have in common is that they all seem to have high histamine symptoms, and they all seem to have vagus nerve problems as well. So
wow, really?
If you actually look at the symptoms of long COVID, they're tiredness, shortness of breath, chest pain or tightness, memory and concentration, insomnia, palpitations, dizziness, joint pain, depression or anxiety, tinnitus, sickness, diarrhea, stomach aches, fever, coughs, headaches, rashes. They're very similar to the symptoms we spoke about at the beginning, which are histamine. Yeah. And there's lots of people on long COVID support groups now, all trying to help each other along. And the thing that a lot of these long COVID sufferers are finding is that reducing histamine in their diets is making a significant difference to what's going on, because we know in long COVID that there's inflammation hanging around in the body. A lot of my clients are coming in and talking about having heart palpitations. It's because there's inflammation left around the heart. The heart itself is fine, but there's inflammation sitting around it. So there's inflammation hanging around in the body that's not resolved. And we know that histamine is a driver for inflammation. It's one of those signaling pathways. So cutting down histamine seems to be making, or cutting down histamine foods seems to be making a big difference to people that have got long COVID. And I'm using sort of anti-inflammatory, antihistamine herbs to try and support them as well, and using vagal tonics, bitter digestive herbs, bitter herbs and nervous system tonics to tone the vagus nerve and send it into its parasympathetic mode, relax, digest, slow down, dampen down that inflammation. And using those combinations seems to be bringing some really good results for people.
Wow, that's amazing. So go through just some of the herbs that you're prescribing. I suppose that somebody who thinks that they may have a problem or they've got long COVID, they should actually seek help from somebody like you, a medical herbalist. But just to go through some of the things that you might be prescribing, what would that be?
So bitter herbs, we tend to avoid bitters. We don't like them. We tend to steer towards sweet and sour in our Western civilization. So even bitter tasting foods can be good. But bitter herbs would be herbs like dandelion root, gentiana. I use wood betony, particularly when I'm working on the vagus nerve, because it seems to connect the heart and the head. I see it as being the connection between the two. I use andrographis, which is a digestive bitter and it's an immune herb. Lemon balm, anything that increases GABA in the brain, so relaxing herbs. Valerian would work on the vagus nerve, so anything that boosts GABA levels up. Green tea would do it as well. Then all of these things can be taken to support vagal health. But also you could do things like, as I say, stretching, yoga, yawning. Just yawning and going through the motion of yawning activates the vagus nerve, because it comes in through it does innervate around that jaw area. And in fact, the vagus nerve connects to the ear. And I've got one woman who came to see me with a really bizarre presentation where last year she started with a sore ear, and then it led on to this awful chronic fatigue. And when we backtracked, we actually think that she probably had COVID. And the connecting factor was the fact that, by the way, your vagus nerve connects to your ear. That's, it was a really bizarre sort of thing looking at that particular case. And in fact, that case made me sit up and take note of the whole vagal aspect to COVID. And if you actually Google vagus nerve and COVID, you'll see that there's actually lots of interest in using electrical vagal nerve stimulation to dampen down long COVID symptoms.
Wow, and what a great example of the need to look at something holistically and not just look at one symptom and say, oh, I'll do something for that and it'll go away.
Yeah.
You just can't do that anymore, can we? Well, we never could, but it's just not the way forward.
No, it's not the way forward. And, I really hope that, a positive that comes out of COVID is that we actually start to look at inflammation, histamine, whole body health, and start joining up the dots. I think orthodox medicine is beginning to take note of that and realise that we do actually need to look in a very holistic framework. We can't just treat one symptom. We need to look at we're interconnected. We have our nervous system. We've got all this histamine through our body. It's in our connective tissue. It's everywhere. It's all joined up. It's not that you've got a respiratory system that's separate from your bladder and separate from your joints and muscles. They're all joined up together. We're not separate systems of the body.
Absolutely.
And we need to acknowledge them all together and look at them all together.
Absolutely. Well, Keren, thank you so much for joining up a whole bunch of dots for us.
I hope I joined them up a little bit, and I've not, as I say, I sat down at the beginning and I thought, how am I going to explain all this? It's so big.
But this is why I wanted you to come back and talk more about it, because I think it's such a big issue, such a big problem. I don't like using the word problem, but you know what I mean. I think people who are listening will really appreciate what is involved, and that histamine is something that we need to start looking at with different eyes.
very different
just
eyes.
as hay fever. It's not just hay fever. It's
no,
not just
it's
insect bites.
so much more than that. Absolutely, so much more than that. And in balance, it doesn't cause us any problem. Anything in balance doesn't cause us any problems.
Right,
It's when it goes out of balance, then it makes itself really pronounced. It really makes things stand out. Yeah.
Absolutely.
So yeah, I think it's a real missing link in a lot of things. And yeah, I've been joining the dots up for a few years now. You know, I used to struggle treating problems like rosacea in clinic. What is it that's going on with this person? Well, it's histamine. You know, interstitial cystitis. Oh, what's going on with this person? Oh, it's histamine. You know, it's the missing link in so many things that we're managing. And I think the combination of looking at histamine and the vagus nerve and really drawing things together on those two fronts, I think just pulls an awful lot together in what's going on with the body.
Wow. Well, thank you so much. We'll leave it there. And if anybody feels that they have any histamine issues, they can Google what they might do about it. They can
loads of information out there.
Yeah,
absolutely.
There is. And they can certainly find a histamine diet sheet. There's plenty of those on the internet, or they can get in touch with you at healthfoodandmore.co.uk. Thank you, Keren.
Okay, you're welcome, JJ. I've enjoyed that. And actually, it's been a really good learning experience for me because, you know, I was researching last night. I've come across so much really interesting information that I can use in my practice as well. So thank you for the opportunity to come on and discuss it with you.
You're very, very welcome. It's a win-win then for everybody.
Absolutely. I always love a win-win.